Assalamu alaikum. My name is Dr. Mohammad Kashif Iqbal. I am working as assistant professor in the Institute of Continuing Education and Extension, COAS Bahawal. Today, my topic of presenting is probiotics, a potential alternative tool to antibiotics therapy against mastitis causing pathogens in dairy animals. First of all, I want to start from the introduction. Actually, the dairy sector of Pakistan is increasing day by day rapidly, and it's play important role both for the life of people and national economy. Pakistan is ranked at number 4th on the survey of 2023, recorded milk production 59.7. And mastitis is directly linked with the milk production. Mastitis is actually expensive and important disease of dairy industry, and here some management expert says that actually this is not a disease, this is a managemental problem which results in deteriorating the quality of milk. In spite of global efforts and different mastitis control programs, mastitis has remained economically the most important disorder in dairy cattle and is still a major challenge for the dairy industry. Various antibiotics are used more rationally for the treatment of mastitis in dairy animals in developing countries without any dose determination and culture sensitivity testing. Consequently, antibiotic resistance has been developed against all the classes of antibiotics due to overuse of antibiotics. And secondly, there is no monitoring of withdrawal period of that antibiotics used in the field and the home. And through the milk, people are consuming this milk, antibiotic residues, rich milk due to lack of knowledge, which is not good for the consumer health. So, it's the entire need of the time to find antibiotic alternative for the treatment of mastitis in dairy animals. And as my topic is probiotics, and we are treating this with the probiotics, especially lactic acid bacillus are such compounds that have antimicrobial-like properties against mastitis causing pathogens and are good for animals' health because it enhances the growth of animals along with boosting the immunity of animals. And my scope and my objective is keeping the view of utilization importance of milk along with economical and substantial losses due to the mastitis. The present project is designed to study the in vitro and in vivo efficacy of probiotics against these mastitis causing pathogens. Number two, to control the mastitis in dairy animals. Number three, production of antibiotic residues free milk for human consumption. And to reduce the economical losses due to the decrease in milk production. And in last, development of alternative tools for the control of drug resistant bacteria strain. And now we are going towards the methodology for in vitro and in vivo. First of all, I will start with the in vitro efficacy of probiotics. For this in vitro efficacy, first we do the isolation of mastitis causing pathogen. Bacterial isolates will be collected from clinical cases of mastitis in and around the Bahawalpur. The confirmation of MCP performed by conducting various biochemical tests according to the Wong et al. And antimicrobial sensitive in vitro antimicrobial activity, uh, especially lactic acid bacteria strains against mastitis causing pathogen will be tested by a streak-line method. The inhibitor effect will be assessed from the thickness of the inhibition zone and will be graded as more than 25 mm will be high, intermediate 13 to 25, and no low is 1 to 12, and no. Number three is a co-aggregation assay. The interface between the lab strains and MCP will be evaluated according to the previous study. The positive co-aggregation will be measured when lab strains will be closely acid MCP. It will be described as negative when co-aggregation will not occur in 5 observed areas in 1 positive rod, 2 positive rod, and 3 positive rod. were reported when coagulation will be examined in 1 to 2, 3 to 4, and 5, the 5 examined area. This coagulation assay of probiotic will be performed in and autoinhibition assay, antimicrobial between the lab strain will also be tested by streak-line method. Growth curves. Specific growth will be calculated as per previous study of Malthus model. Now we are talking about the in vivo efficacy of probiotic. Dairy animal will be selected from government livestock farm Bahawalpur to conduct in vivo probiotic efficacy trials against mastitis. And for the eligibility, including criteria, if they have four functional quarters, they are some parameter, they have four functional quarters with no significant lesions, having good health with known somatic cell count like 2 lakh in 1 ml of milk, and will have not administered any type of invalidity drugs during 14 days previously before the commencement of present study. And there are some outcome of my study. The probiotics will be good alternative antimicrobial agents for the treatment of mastitis in dairy animals. Potential count of drug-resistant bacteria against mastitis. Economic losses of livestock farm will also be overcome, and the production of healthy milk and food products without antimicrobial residues. This is my project team for this project, and me myself, Dr. Khalid Mahmood, will become my co-PI. IB Bahawalpur, Dr. Ijaz Salim from UF Faisalabad, Dr. Hui Chow, my ex-lab mate from South China Agriculture. Thank you so much.